Welcome to the Natural Health 365 Talk Hour. I'm your host, Jonathan Landsman. As a quick reminder, Natural Health 365 Talk Hour show recordings, special events, and discounts are available exclusively for Inner Circle monthly subscribers. Simply click the banner you see on this page and subscribe now. Our show today, Bartonella Disease, a misunderstood vector-borne infection. Our guest, Dr. Tania Dempsey, is an expert in chronic disease, autoimmune disorders, and mast cell activation syndrome. Dr. Dempsey is sought after internationally for her knowledge of chronic immune dysregulation and has attracted patients from Israel, England, Thailand, and France. Using integrative medicine to get to the patient's root cause of their illness, Dr. Dempsey's purpose is to understand why people get sick and to help patients understand their body and why it fails when it does. She received her medical degree from the Johns Hopkins University School of Medicine and her Bachelor's of Science degree from Cornell University. In addition, she completed her residency at NYU Medical Center Bellevue Hospital and then served as an attending physician at a large multi-specialty medical practice in White Plains, New York, before opening Armonk Integrative Medicine. Please join me in welcoming Dr. Tania Dempsey to our show. Dr. Dempsey, welcome.
Thank you.
Oh, it's my pleasure. This show is for educational purposes only. Always consult a trusted healthcare provider for medical issues that concern you, and as always, make an informed decision. For more information about Dr. Tania Dempsey, visit drtaniadempsey.com. Dr. Dempsey, talk about what vector-borne diseases really are, because for me, I'm going to learn a whole lot today as well. And why are they spreading, as you say?
Yeah, this is a huge problem worldwide. Vectors are basically things. In this case, we're going to be talking a lot about insects or things like insects that carry diseases. So vectors are the things that carry the disease and infect animals and humans. And there are many, many different types of vectors. So vectors can be things like mosquitoes. So things like malaria can be transmitted, or West Nile virus is one that we've heard a lot about as of late. And that infection is carried by that vector, and then the mosquito bites, let's say, the human, and then transmits the infection. So mosquitoes are vectors, and fleas and ticks and biting flies and spiders even, all of those can carry infections. And obviously they're everywhere around us, and so we really don't have a great line of defense against them.
I'm just curious, as I'm listening to you talk about this already, if someone innocently gets a mosquito bite, it's a little red, it's itchy, for a few days it's kind of annoying, and then it goes away. Is it possible that an infection is left in the body that somehow would fester maybe for a little while, if not for years, and manifest itself into something more serious later? Or am I kind of making this more of a big deal than it really should be?
No, I think unfortunately you hit the nail on the head, and that's the problem. I think about a lot of patients that I see, for instance, who have Lyme disease. And they'll say, well, I don't even remember getting bitten by anything. I don't remember when that was, or I might have been bitten 20 years ago. And the problem is that something can bite you now. You may not notice anything for years and years and years. And depending on your immune system, it may never affect you. But if your immune system is compromised, if you've been infected with enough of other types of infections as well, you're under stress, you don't sleep, you don't eat well, all those factors can make you more susceptible to that infection, coming out later.
Okay, so Bartonella disease, I know it's referred to, as you talk about this, as like a Lyme co-infection. I'm sure other doctors might even refer to it that way. Talk about Bartonella disease a little bit more, and is that an accurate way of describing it, that it is a Lyme co-infection?
Yeah, I think it's actually not a great term because it's not a implies that it's with something, and there's no question that there are many Lyme patients who also have Bartonella. In that case, it is a co-infection, but so many more patients now we're seeing only have Bartonella. They don't have Lyme disease, That's actually why they're being misdiagnosed or underdiagnosed, because the doctors are checking them for Lyme, ruling out Lyme. They don't have Lyme, and then they really don't know what else they have. Many of them just have Bartonella, which in itself could be even more devastating than Lyme. So it's not it can be a co-infection, but I'm looking at it as a serious issue on its own.
I think it's amazing we have you here as a guest. I mean, you've been conventionally trained in medical school, gone through all the Western medical training. I mean, I'm sure you're dialed into this particular disease, but I'm wondering just for a moment, how many other medical doctors really know, anything about this or to look for it? I mean, of course, Lyme is very popular, but Bartonella disease?
Right, exactly. Well, I'll tell you, back in my training, back in medical school, we learned, I probably had, maybe 10-minute discussion on Bartonella, and we were taught about it as a disease called cat scratch fever or cat scratch disease. And we were taught that the only way you really could get a Bartonella infection is if a cat scratched you or bit you, and then they could transmit that infection. So we were taught early on that cats could be carriers for this. But that's all we knew. And so as patients are coming in and they don't have cats and they weren't scratched by a cat or bitten by a cat, it's not necessarily going to be on the top of the list for doctors who were trained with that information. So you're absolutely right. This is part of the problem, and this is why I think this is really an epidemic that is unrecognized at this moment in time. But it needs to be recognized, and that's why I'm here trying to educate people.
No, I think it's very important. And also just crystallize it for me then and for everybody listening. Is it just from cats or, like you said before about vector-borne diseases, is this from just about any bug can actually give this to somebody?
Well, yeah, right now the literature has shown that Bartonella can be transmitted by ticks for sure, and that's why people are getting Lyme and Bartonella together. But it can be transmitted by fleas, by spiders, by biting flies, by lice, and possibly mosquitoes. And so yes, clearly you don't need to have a cat to get it. I will tell you that having a cat definitely is a concern now, and I do often recommend my patients get their cats tested if there's a high index suspicion that the patient has Bartonella. Now, dogs are carriers of Bartonella as well, and maybe not quite as common as cats, but still fairly common. And I have patients who got Bartonella from their dog, and that's a possibility, or the flea that bites the dog that then bites you, and that's a possible form of transmission. So the problem with Bartonella and why it's different than Lyme is Lyme is being transmitted by a tick. And so the focus is on that one insect. But Bartonella is being transmitted by lots of insects, including arthropods, which are not insects, spiders. And so now, we are potentially, transmitting this, at a crazy level, right? This is, you can't even comprehend how many people could be infected.
Well, and also when you couple the idea also that it could have been some sort of innocent, or at least on the surface, seemingly an innocent bite 2, 3, 5, 10 years ago. And like you say, the immune system breaks down, person's life goes on, and they kind of get a little weaker. And that's when these things sort of rear their ugly head. I want to talk about the symptoms, what it looks like. And I want to just put it in this context too, Dr. Dempsey, because I know with Lyme, it can be complicated enough for a lot of physicians and people to sort this out. I mean, I know from doing the Alzheimer's and Dementia Summit, and I also hosted the Immune Defense Summit, I've dived really deep into these topics that you could have a foggy brain and, you're 65 years old, and come on, most physicians are going to say, oh boy, let's kind of look at this. Maybe it's dementia. But meanwhile, the person could simply be infected infected inside and it's affecting their brain function, and it's not really dementia per se, but it's Lyme disease that they should be treated for. Now we're talking about Bartonella disease. What does that look like? And maybe make the distinction between Bartonella disease, what that looks like compared to maybe Lyme disease? I don't know.
Well, there's no question there is an overlap, and sometimes it really is impossible because you can get, for instance, Lyme disease, a lot of people think of joint pain, joint swelling, and things like that. Well, unfortunately, you can see the same to some extent with Bartonella. So there is some overlap, but there are some clear distinctions, and there are things that help me determine whether I'm going down a Bartonella path or a Lyme path or both. One of the main things that we see a fair amount of is a typical type of rash. I call it typical. It's really not that typical because it really can look very, very different, but it has the appearance of stretch marks in some people. They can get it across their back, along their flanks, their inner arms. I've seen that rash actually in many, many places, even in places where you wouldn't think someone would have stretch marks. I've seen it in skinny people and heavier people, and it has nothing to do with the weight. And that's what people think. People think that they get these stretch marks, and it's because of a weight change. And the doctors they see, tell them the same. But it is often, especially when it's red, it's like a red stretch mark. It's usually a grouping of them. And often it has like a horizontal appearance to it. And that is a classic Bartonella sign, and it goes away with treatment. Stretch marks don't go away. So that is a definite indicator. Now, not everyone will have that manifestation with Bartonella, but if they do, it's a good indicator. Bartonella also causes a tremendous amount of neurologic dysfunction. So does Lyme, obviously, and can cause, Lyme can cause dementia and things like that, and so can Bartonella. With Bartonella, we see a little bit more of an autoimmune encephalitis type picture, which Lyme can cause too, but Bartonella definitely will send the patient into a tailspin. They get obsessive thoughts, OCD. They get anxiety. They can become bipolar, mood swings, irritability, anxiety, depression, and they can have significant cognitive difficulties, not enough to be called a dementia, but there's no question that there's a processing issue, and we see this a lot in kids and in adults. And when you see this in a 5-year-old, it's not dementia. It is an inflammatory process in the brain that is being driven by Bartonella and then driven by the immune system. So those are probably the two biggest things that help me distinguish Bartonella. But honestly, it can really affect every single organ system in the body. I've seen it affect the liver. I've seen it affect the heart. I've seen it affect the lungs. So really, it can be quite difficult, as all these tick-borne infections do overlap.
I think what you're also describing to me, anytime I hear a physician as intelligent as you, as open-minded, and really appreciating what's going on here, whenever they're talking about it like you are now, I just kind of get a sadness, in picturing the person who's suffering, right? They're really suffering, right? And they have chronic fatigue, or they have that anxiety blended in, and they're in the office, and you know what that person appears like to a physician. And then, my goodness, a psychiatrist gets a hold of somebody like that, and you're depressed and you're anxious. Why don't we just give you some pills? If you're in a primary care physician's office, what do they have? 3 minutes, 5 minutes? Wow, you sound really bad. I totally get it. You're stressed out. Try to reduce your stress, right? And nobody is making enough. And I know I'm oversimplifying, but I feel like I'm more right than wrong.
I think you are.
Nobody is really looking at, wow, somebody is physically, mentally, or emotionally struggling, right? With whatever they might be articulating, oh, my job, my life, or this or that. but then in the background for a really well-educated healthcare provider to just appreciate, you know what? Maybe there's a possibility that the person has an infection. That's my point, that it would just be great if we could shine a bright light on the idea that if someone is chronically suffering like you just described, infections are probably not too far off the mark for a lot of people.
No, and I think that it's probably the majority in my, at least in my patient population. The more I see, and I know that my chronically ill patients who are suffering with these symptoms are suffering because infection is driving this. For sure, there's a toxicity issue. We live in a very toxic world. We're being bombarded by pesticides and heavy metals and plastics and all these things that are also compromising our immune system and compromising our cells. And it's sort of the perfect storm. But there's no question that people need to start thinking about infection in these patients. It is so sad. My heart breaks when the patients come in and tell me how many doctors have told them that it's in their head, that they should just relax, meditate more, or whatever it is, leave their job. That's not the solution. These patients, sure, you know what, at this point they probably are depressed because of how miserable they are, but that's not the problem. The problem is that they have a physiological, organic cause. There's something, that is again, it's physical, and that needs to be addressed. That needs to be treated. Well, first you have to diagnose it, and then you have to treat it appropriately. And these patients are led to believe it's not physical.
We're going to talk a little bit more about why the condition is so difficult to diagnose. We're going to talk about testing, of course, the connection between genetics and bacterial infections. A lot of really cool stuff we'll get into in the second half of the show. But Dr. Dempsey, already I love what you're saying because it's about having a full appreciation of, look, what is going on in your life? If there are mental, emotional issues, problems at the job that have been going on a long time, everybody likes to go outside. Maybe you did get bit by a bug. Okay, fine. We're not trying to do a show here for everybody to just live in fear. That's no good for your immune system and not good for, keeping the risk of infections down, is that everybody should be afraid of a bug. That's not the point. The point is the totality of our message here is take a good look at your life as soon as possible at any stage that you're at, because anything you can do to get further and further away from toxins that you mentioned, environmental, whether they're in the air, the food, the water, just really trying to calm down the inner fires, right? That chronic inflammation that's going on in the body, you're just going to be more apt to have that buffer, that natural defense, so that we can live our life relatively symptom-free and really enjoy it at a high level. Isn't that what this is all about?
That is exactly. Yep. I couldn't have said it better myself.
And as a quick reminder, NaturalHealth365 Talk Hour show recordings like the one you're listening to right now, special events and discounts are available exclusively for Inner Circle monthly subscribers. Simply click the banner you see on this page and subscribe today. So, Dr. Dempsey, maybe you've mentioned it a little bit before, but for those really trying to listen a little bit more carefully now, why is Bartonella disease such a difficult condition to diagnose? Go over that just for a little bit.
So, the testing is a big problem. Some people may be aware that even with Lyme disease, it's also very difficult to test. What's really available most of the time in commercial labs is what's called antibody testing. And so, for Lyme disease, for instance, we're looking to see if the person has antibodies against Lyme, and we're making a diagnosis based on the fact that if they have antibodies, we're making an assumption that they've been exposed to Lyme and potentially are sick from it. It's sort of the same with Bartonella. The testing may even be even harder with Bartonella. a lot of these infections are not necessarily circulating in the bloodstream. So when you draw blood, you're lucky if you could obtain that bug right through the blood draw. But most of the time, the bugs are hiding. Or they're hiding from the immune system, and Bartonella has a real stealth kind of way of it's called a stealth infection. It has a way of hiding and camouflaging itself to the immune system. And when it's like that, first of all, you're not producing antibodies against it because you don't even know it's really there, and it's certainly not circulating in the bloodstream that you can actually try to sample it and get it to grow. So a lot of these infections are difficult to test for. Bartonella is just another one of them that is. There are some labs now that are doing research. They're getting better. They're now trying to culture it and do something called PCR, which is really kind of identifying if you have DNA of the bug in you, because if you have DNA circulating, the thought is that it's probably active and it's probably multiplying in your body, and so that must mean that you have that infection. So there are a couple of labs now that are up and coming that are making it better, but for the regular doctors and the patients who are just going to go to, let's say, a commercial lab like Quest or LabCorp or whatever, it's difficult because more times than not it will be negative. And that's frustrating because, again, it's hunting down a diagnosis and constantly being told there's nothing wrong. The other problem is that there are almost 24, actually probably over 24 strains of Bartonella right now. And most labs will test one, maybe two of the strains, the most common strains. But if you're one of the lucky ones who was infected by another strain, the labs are not going to pick it up. So you can have all the classic symptoms and the rash and everything else, but if you have one of those other strains, there's really only one lab in the country that is able to really measure all the strains right now. So it is very, very difficult. I have found the labs that work best, and sometimes we have to repeat specimens a few times, but I think I've been lucky. I've been able, in the last year, I've been able to isolate a positive Bartonella test in 51% of my patients. Now, that's a huge number, by the way, 51%.
Wow, that is just incredible. I got that right away. But Dr. Dempsey, don't hold back, right? For those people who aren't going to be perhaps fortunate enough just to be able to hear this show and say, wow, I want to just work with Dr. Dempsey, but maybe they're somewhere else. They have to speak to a doctor. What specifically? Again, we don't make any money. That's not my concern at all. I just know that people want to know the details. What exactly would you say, the best test, and what lab should they go to, and how does all that work? Give us a little detail.
So I'll tell you that right now, one of the best tests that I found, and is often covered by insurance, which is key, is bioreference labs. They have they're I guess the third tier in that, LabCorp, Quest, and I think BioReference is probably third in that. It's a pretty large company. They send their Bartonella specimens out to another lab that has been doing a phenomenal job at picking up antibodies to two strains of Bartonella. So that is something that the patients could request. If they're living in an area where there are bioreference labs, they can ask their physician to order a Bartonella Hensley and a Bartonella Quintana antibody test, IgG and IgM, and that is probably the easiest thing to do. And that's my first line. I'll do that and then see where we are. If my index of suspicion is high, I might say, let's try some other labs. Sometimes I nail it with just that lab. There are two other labs that I use very frequently. One is Epigenetics. Epigenetics is an excellent Lyme lab. They really, I think, do the best in the country for Lyme disease. They also do test many of the co-infections. They're right now only testing one strain of Bartonella Hensley, And so that's unfortunate because they're going to miss some of these other strains. So they can be very helpful, and sometimes I can get some good data from them, but BioReference I think is better. And lastly, there's a lab called Galaxy Diagnostics, and this is actually an exclusive Bartonella lab, or it was exclusive. Now they're branching out, and they're going to be testing Lyme and other co-infections. But they started as a Bartonella lab, and they were started by a veterinarian, because Bartonella was really, again, a cat, dog kind of animal infection, and he was studying it in animals, and started realizing that many of the pet owners of those animals were sick also and having some crazy symptoms. And he started testing the pet owners and the pets and started seeing the connection, and was able to identify even the same strains in the animals and in the pet owners. And so now he does the test for humans, so it's commercially available for that. And they do a great job. It's just cost. It's a very expensive test, and there's some requirements for the test, and so that's not something that most of the doctors in the community are going to know about. That's something that doctors like me, who are on the front lines of treating this disease, know about. But BioReference labs, that should be pretty easy for a lot of people. If they can request it, that's a good start.
And the costs for BioReference lab, they're kind of a little pricey too?
No, I don't really even know the price of that, because they've been taking my patients' insurance. So it seems to be a covered test. I can't guarantee all over the country that's the case, but I think it's a fairly reasonable start.
Oh, that's great. And Dr. Dempsey, just switching gears just a little bit here, talk to us about the connection between our genetics and bacterial infections.
Yeah, it's so complicated. I think about it from a couple of different angles. We're born with a set of genes. We can't change our genetics, not yet anyway. And our genetics can dictate how our immune system works, how our nervous system works, et cetera. So there are some key genes that are talked a lot about lately. One of them is called, for instance, MTHFR. Maybe some of your listeners are aware of it. It's called Methyl Tetrahydrofolate Reductase. And it's a gene that codes for a protein that's involved in folic acid metabolism. One of the things we know about that gene is that people who have a mutation in that gene are definitely more at risk for having, I call it toxicity issues. They don't detox very well. Their livers may be a little more likely to hold on to toxins. And so those are patients that sometimes can have issues with getting infection because they are a little more compromised because they don't detox. And so that's one of the genetic components that we look at, is that just the vulnerability. MTHFR, for instance, also makes people more vulnerable to having I'll call it maybe a more sensitive nervous system. So these are the patients who might have anxiety at baseline, a little bit, and they know it's in the family, or a little bit of OCD, but everything is manageable. And then they get an infection on top of it, and it just gets exacerbated. It just brings out, it triggers a reaction in a sense. It's like the gene then gets shut down even more. So what I think about is something called epigenetics, and that is that the interaction between our environment and our genes. So we can't change our genes, but we can change how our genes work. So if we have a gene, for instance, I like to use the analogy, if we have a gene, for instance, like a cancer gene, we would want that cancer gene to be turned off because we do not want to get cancer. And so we have mechanisms in our nucleus of our cells, where our DNA is, to keep the bad genes shut off and to make sure that the good genes are working. What we understand now is that bacteria, viruses, parasites, funguses, they can actually get into the nucleus of the cell. They can attach to the DNA, and they can start playing with the switch. They turn on, they turn off. And so, there is data now to show that Lyme disease has been associated with certain types of cancers, or just an increased risk of cancer, and the question is why. And if the reason is because of this epigenetic effect, that Lyme is potentially turning on the cancer genes in the nucleus of the cell. So this is a real big area of interest. A lot of people are starting to look into this and do research with it. This is the key, I believe. If we can figure out how to manage this epigenetic effect, then that's what's going to ultimately get people better.
And not to confuse or overwhelm people, but Dr. Dempsey, I think everything you're saying, again, is so beautiful how connected it is, and it gives us a deeper appreciation as to why it's so important to understand everything we're doing in our life. It matters, right? That our stress, the way we speak to people, the way we think, the way we feel about things, how we react, the kind of physical things we're doing with what we're putting in our mouth, what kind of food we're eating, is our water quality the best? Do we have mercury-based silver fillings in our mouth that every time we're chewing the best organic food, now we're swallowing some of that mercury into our digestive system, our bloodstream, our lymphatics. It's vapors that are going up into our head. All of these things that might be stressing the heck out of our immune system, compromising our mitochondria function so that now our energy is down. Now we're setting a beautiful stage for that bug bite or something that was introduced into our system to take hold. It's been hiding in biofilm or wherever it loves to hide just because it's good at doing that. And then it comes out later on, and people mostly get confused. I don't get it. I was fine for so long, and now I'm falling apart. What's happening? I think it's pretty much what I'm just kind of outlining here.
I think it is. I think that's exactly right. And, because I have families that when I test them all, they all have various infections, Lyme or Bartonella or both, and Babesia and some of the others, right? But there may only be one or two of them that are really sick and the others are better. So why? What's the difference? So maybe how that person was raised, maybe the parent is fine but the kid is not. So maybe the parent was raised on different types of food. Maybe the parent grew up on a farm and got fresh organic food every day up until then. And so when they got Lyme disease, their body could handle it. But the younger people exposed to more toxins, more fast food, more GMOs and pesticides and Roundup and all those things, then maybe they're more vulnerable. So I think the key message is we do have more control than we think. And if we start paying attention to these things and understand what we're being exposed to and what we're putting in our bodies, it goes a long way.
And isn't it fair to say also, because I want to get right to autoimmune disorders that you are seeing connected with Bartonella disease, but I just want to talk just basically about a perspective, though, for just a moment and get your input on it. Let's say we're getting everything right. We're really starting to work nicely with a healthcare provider. We're getting our stuff together. That's what I'm basically saying. And we're feeling better. But isn't it true, just like I've spoken to many physicians dealing with people with cancer, that you could be feeling so much better? Your energy, your outlook on life, your ability to actually enjoy your life. You could be getting better and better at that and still have cancer. Probably the same thing can be said about this as well. Yes, you're technically still infected, but hey, you're feeling so much better because you got your game together in so many other ways. Is that fair to say?
Yes.
Okay, so real quick, let's move over now because we have so much more still to cover. Autoimmune disorders frequently seen with Bartonella disease. Do you have any?
Oh, yeah, there are tons. And some of them can be caused by other things, too. So I don't want to imply that one of the listeners, let's say, has one of these autoimmune diseases. They don't necessarily need to worry that they have Bartonella, but Bartonella is one of the triggers of autoimmune diseases. And so the ones that we think of are things like Hashimoto's. There's a condition called PANDAS, and it refers to a pediatric condition, pediatric autoimmune neuropsychiatric disorders associated with strep. But we see that a lot. It's actually PANS is the correct terminology related to Bartonella, and that is an autoimmune encephalitis. That's a attack on the brain, and we see it in kids and we see it in adults, and I see it in older adults too. That's a very big autoimmune disease that I've been seeing a lot of, which is really a very difficult thing to treat, but is something that's part of my life's work here, and many others, like we see the onset of celiac disease from Bartonella. We'll see the onset of lupus, rheumatoid arthritis. Any of those could theoretically be triggered. And the reason Bartonella can trigger it, but again, other infections can too, is because the immune system is trying initially. Let's say you're infected with Bartonella, your immune system will recognize it as foreign, will try to fight it off. But because Bartonella has these really incredible hiding, camouflaging techniques to get in, it gets into cells and it hides in ways that the immune system all of a sudden doesn't see anymore, but it can still recognize that maybe that part of the body is something is wrong with it, but it may not understand that it's Bartonella. It will start to attack, and in a way, you're attacking yourself. So if the Bartonella, let's say, gets in the thyroid gland, and it's sitting there, but your immune system doesn't see that it's Bartonella, but it knows the thyroid looks different, it's going to attack the thyroid, and you're going to get Hashimoto's, thyroiditis. So I'm making it more simple than it is. It's a complex thing, but there's no question that an infection, a toxin, etc., anything that is foreign to the immune system can trigger it to react inappropriately against itself. And when it attacks the nervous system and attacks the brain, that's where you're getting all those neuropsychiatric conditions and cognitive dysfunction and dementia and all those types of symptoms. So it's autoimmune disease is on the rise, and we need to start thinking about what is the trigger, and this is one.
I don't know how many people who actually feel completely fine are still plugged into what you and I are saying, but I've said this so many times on shows before, Dr. Dempsey. It's just so important to lay the groundwork as fast as possible. Do a lot of things just step by step, one thing after the other, whatever resonates best with you, to clean up your act in terms of the way you're eating, what you're drinking, how your immediate living space is, the bedroom, where you're working, as much as you can. Really try to clean these things up. And also, number two, even though it doesn't seem to be so pressing, know someone like you. If not so much like as a friend, but at least to have that literal professional relationship set up with a great healthcare provider. I certainly am blessed to have a very good friend who's a doctor of osteopathic medicine, an ND, licensed acupuncturist. He's studied Buddhism, all of these things. He's just a wonderful, well-rounded individual where I can sound off and get feedback. And it's just so important to have that person in your life, because God forbid something like this really happens and you get overrun and you're exhausted and it's affecting your level of thinking. And even worse on top of that, and I'm not trying to scare anyone, I'm trying to be realistic here, maybe people in your home are not exactly PhDs, medical doctors who totally get what's going on here. What I'm saying is they might love you, but they can't help you. So it's just important to have that good team around you. And so, Dr. Dempsey, mast cell activation syndrome, I mentioned it just for a moment at the beginning. You're an expert at that. Talk about what the heck this syndrome is and why is it connected to Bartonella disease?
Well, so the why is something that I am investigating and going to be doing research on, because I don't know if we know why yet. What we know is that we have in our bodies a type of white blood cell called a mast cell. And these mast cells are one of our lines of defense against things that are foreign to it. So we know mast cells help to they respond to allergens. So they're the cells that react when people have, let's say, an allergy to something, to a food, to a peanut or a nut or pollen. Mast cells are what's reacting to that. But mast cells react to infections and toxins and medications and lots of other things. And within mast cells, they have these granules that contain lots of different chemicals. One of the chemicals that people might have heard of is histamine. Histamine is what causes people to have allergic reactions, but mast cells are so much more than just involved in that allergic reaction. Mast cells, again, if they're fighting Bartonella and they see that as foreign, they're going to explode. That's their mechanism of trying to fight off that bad thing, and they'll explode. They'll release histamine. They release lots of other chemicals. There are actually over 200 chemicals that can be found in these mast cells. They're natural chemicals. I mean, they're made by the body, but they are actually inflammatory and kind of toxic to us if they're released in that way. And so as these mast cells are seeing Bartonella, they're exploding, and they're causing inflammation and damage to the cells wherever they are. So I think about it as a lot of Bartonella patients have they have a lot of GI complaints. They may have bloating, they may have indigestion, they may have nausea, vomiting, diarrhea. I've seen the gamut. And obviously those symptoms can be caused by a lot of different things, right? So some doctors would say you have reflux. Some doctors would say you have IBS, right? So it's a non-specific symptom, but in the case of when we've isolated it to the infection, let's say the Bartonella is in the gut, it's in the cells, it's hiding, but it's causing damage. The mast cells are also in the GI tract, and they're trying to protect against that infection, and they can start to explode. And when they explode, they will irritate and cause more symptoms. So a lot of patients who have mast cell issues notice that certain foods will affect them, and because the mast cells are reactive. They're reactive to the infection. They're reactive to whatever else they're being exposed to. They're sort of inappropriate. They don't even know what they're reacting to anymore. And so wherever the mast cells are exploding, they're causing the symptoms. And so this is, I think, one of the, and I say think because this is still an area that's not clear. There's not enough data or research, and that's one of my missions is to really understand this piece better. But I think that this reactivity in the immune system is what's really driving a lot of the symptoms that patients exhibit with Bartonella, and maybe other infections as well. It's not just about the Bartonella, but it is a complex syndrome. It's hard to diagnose for a variety of reasons, but when we get it and we can treat it, it could cause a real significant improvement in quality of life, and then it allows us to get to the real root, which is the infection.
Okay, and I'm certainly not going to, be so presumptuous to say that, what we're going to do now is spend a few minutes as to how anyone with Bartonella disease, hey, you're going to be just fine. Listen to the next few minutes, and we're going to treat your disease, and everything will be great. Obviously, we're not trying to do that with any of these shows, but Dr. Dempsey, I mean, you have a lot of experience, a basic overview, some step-by-step things to kind of dive a little deeper and give us that little outline, if you will, is the best way to, go after this thing and try to calm things down.
So I think what you mentioned earlier about finding somebody or a doctor that you could work with, that you can talk to, that's critical. So if you know that the doctor you have now, he may be smart, he or she may be smart, may be very good at what they do, but if they're not listening to you and what's going on in your body, you're not going to get anywhere. So I do recommend, finding a partner in this, and you want somebody who's going to be open, who might not understand this themselves, may not know enough about it, but is willing to learn. I love when my patients send me information that I don't know about, because then I learn from them. I learn every single day. And so you want a doctor like that who's going to say, well, I never treated Bartonella, but if you think that's what you have, let's figure it out together. And so you find that person, you order some blood tests, and again, some of the blood tests can be done through a regular lab, like BioReference is the one that we use here. And, you order some, you talk to the doctor about ordering some of the tick-borne infections. It's worth testing for Lyme. It's worth testing for the Bartonella infection. It's worth testing for some of the other ones like Babesia and ehrlichiosis, and there are a few others. And so I always recommend just cast a fairly wide net. Look at the infection piece. I always also look at viruses. I like to see what people have been exposed to. And then I'm also going to you'll want a doctor to look at your immune system. Look and see how your thyroid is. Look how your hormones are. Look at some key vitamin levels like vitamin D and B12, because you can start to get a sense of how the body is and what shape it's in. It's not perfect, but it does give us an idea. And that's kind of the start. And then what I do is when we find the answers, I start to put the picture together, and then we start talking about treatment. Now, number one, before even treating, I am talking to my patients about diet. I'm talking to them about lifestyle. I'm talking to them about toxins and exposures and things like that, because if that isn't taken care of, all the antibiotics, herbs, or anything else we use for Bartonella, they're not going to work. A lot of patients will say, well, why aren't you treating me right now? I have this. And I say, yeah, I know, but we got to clean the body up. We got to clean the gut up. We got to prepare the body. And sometimes that takes care of the problem. The infection may still be there, but it's hiding in a way that's not affecting you. So sometimes it's as simple as cleaning up and detoxing first, and maybe that's it. That's all they need. And then sometimes we then go in and we say, okay, well, how can we start addressing the immune system better? What kind of support do we need? And the adrenal glands are often suffering during this, and so we'll want to support the adrenal glands. And a lot of that is done as natural as possible, with supplementation, foods, etc. And then we're left with, what do we do about the bugs? How do we address that? And my preference is always to do it as naturally as possible. There are lots of herbs. I sometimes do homeopathy. There are options. Unfortunately, there are patients who will require antibiotics for a variety of reasons. And that's something that we explore with the support of the right diet and the right herbs and everything else. So that's sort of how I run through it with my patients in a general sense.
Yeah, this is great information, Dr. Dempsey. I want to thank you so much for your time, and I want to thank our listeners for joining us today. For more information about Dr. Tania Dempsey, please visit drtaniadempsey.com. Next week, we'll have a great show for you. Be sure to check this page for updates coming soon. If you know someone who would like to hear these free weekly shows, tell them to go to NaturalHealth365.com and register now. Natural Health 365 Talk Hour show recordings, special events, and discounts are available exclusively for Inner Circle monthly subscribers. Simply click the banner on this page and subscribe today. I'm your host, Jonathan Landsman. I hope you enjoyed this program. Thank you so much for your support. Talk to you soon. Take care.